Okay, you're at your IV station. You are dispatched to the home of a 65-year-old male who is dizzy and has a heart rate of 45, blood pressure 90/50.
Okay. PSI, scene safety. I'm going to go ahead and recognize the need for an IV at this point. Go ahead and take my solution, make sure it's the proper solution of its container. I'm going to check for any particulates, make sure it's unexpired. Grab my IV drip set. Place it into the container, flip it back. Make sure it's filled at the halfway mark. I'm going to go ahead and release any excess bubbles, flush my line. My line is now flushed. I'm going to hand my line in as clean a manner as possible. Next, I'm going to go ahead and take a look at my patient's arm. I'm going to ask my patient if he has any allergies to medications, any allergies to anything at all. You go ahead and palpate a suitable IV site. Place my tourniquet. Inform my patient exactly what I'm going to be doing here. I'm going to be starting an IV in order to give him meds, in this case, atropine sulfate. Palpate a good AC. I'm going to cleanse my site in a circular motion, inward to outward. Make sure my tape is torn, then ready to go. While my alcohol is drying. Prepare a suitable sized gauge needle, in this case a 20. And now that my alcohol is dry, I'm going to pull the skin taut without actually touching the area of cleansing, going bevel up. I'm going to count to 3, look at my patient, let them know what I'm doing. 1, 2, 3. Insert my needle. Look for blood in the flash. I'm going to advance my catheter while withdrawing my needle. I'm going to occlude. Dispose of my needle in an appropriate box. Pop my tourniquet. Connect my line. So I have my line connected. I'm going to open it up and make sure it flows. And it's flowing nicely, so I'm going to go ahead and dial that back down to TKO. While I go ahead and secure my IV in place. Alright, now that I have my IV line established and set, I'm going to go ahead and select my medication, in this case atropine sulfate. Atropine comes in 1 milligram in 10 milliliters. For this case, fairly stable bradycardia, I'm going to go ahead and use 0.5 milligrams. And using my medical math, that's going to be 5 milliliters. I'm going to check my 6 rights of medication administration. Right patient, right dose, right medication, right route, right time, right documentation, and right route. I'm going to go ahead and cleanse my port with alcohol. I'm going to go ahead and clamp off or pinch off that site. Administer my 5 milliliters. Watch for any infiltration around the site, any edema, any swelling. Withdraw my medication, dispose of in a properly suited container. Go ahead and push through approximately 20 cc's worth of fluid and dial that back down to TKO and monitor my patient for any changes.